Walk me through the different stages of sleep and what happens throughout a night.
So once they fall asleep, they first in stage one. Okay, so stage one sleep. Think of this as relaxation. Someone who's in stage one sleep might actually feel like they were awake. So if you were in stage one sleep and then I woke you up and asked you, "Hey, were you sleeping?" You might say no. No, because you're still a little bit connected. Might still hear some, sounds in the room. There's still some awareness. Then that usually doesn't last too long, a couple minutes. Then you go to stage two sleep. Stage two is what I would refer to as general light sleep. Okay, here you are unconscious and heart rate, all those processes more regular. Okay. And then you progress to stage three. Stage three is where the magic happens, right? Stage one is brief, 5% of your total sleep time. Stage two, 50%. Stage three, about 20%. Stage three is arguably the most important because now you're in stage three sleep. If I look at the brain waves, I see these giant waves, big. That's why we call it delta sleep, because we see these big delta shape waves like this. Can't miss it if you were looking at an EEG. And now you're releasing growth hormone. 70% of the growth hormone that your brain releases is during stage three sleep. Now, that growth hormone is going to help you build muscle. It's going to help you repair tissue. It's also going to help in the production of other things like antibodies. Okay, so general healing. Think of that. General healing as a result of the growth hormone released in stage three sleep. In stage three sleep too, as I said, you're making antibodies, all your immune functions. There are things like Treg cells. Okay, these are cells that basically help determine what is a threat, what is not a threat in the body. Okay, so these guys are out there surveillancing, and so those are released during stage three sleep. So if an individual is not getting their deep sleep, there's a higher risk that their immune system is going to be dysregulated. They might mount an immune response to their own self. That's autoimmunity, right? So critical for immune functioning to know what is actually a threat and what's not, how to deal with that threat is during stage three sleep. And then memory consolidation is a big one too. Specifically something called declarative memory. Declarative memory is the type of memory like remembering a date or remembering someone's name. This is why they say before a big test, make sure you get a good night's sleep, because you'll actually recall that information. You have to put that information into long-term memory, but then on test day, you actually have to be able to recall it too. And so stage three sleep plays an important role in there. And then now we progress to REM. REM stands for rapid eye movement. REM sleep is often, I have a lot of patients, they say REM sleep is the deep sleep, right? And I push back a little, because if you look at the brain when someone is in REM sleep, it looks wide awake. Okay. The body is relaxed during REM, but the brain is wide awake. Okay. It is the stage of sleep where someone's dreaming. Okay. So all those processes, visualizations, emotions, all that stuff is being processed during the dream. And memory consolidation happens here too. But the type of memory consolidation that happens in REM is very different from the memory consolidation that happens during deep sleep or stage three sleep. Instead of it being declarative, meaning like the facts, in REM sleep is where we code the memory of the emotion attached to a certain event. Okay. It's a very creative state. hence the dreams. And so REM sleep actually plays a very important role in our ability to emotionally regulate in a way where we are disconnected from the actual stimuli. So let's say I had a stressful day. You notice how often the stressful aspect of your day ends up in some form in your dream. And so think of it, that is your brain's way to try to break down that event so it can figure out, how am I going to deal with the emotion of it in a way that's safe, because you are separate from the actual event. We're no longer in the event. Now it's just all imagery, basically. But it plays a critical role, such that individuals who don't get enough REM sleep are at significantly higher risk for anxiety and depression. Their mood directly can be affected. So that's one of the important reasons why we need to dream. Do we remember our dreams? We may forget our dreams pretty early. Like, after the first few seconds of waking up, if we don't write it down or something, we might forget it. But the more important, are we aware that we dreamt at all? If someone says, I don't dream, that's concerning. I would want to know, are they getting REM sleep? And if they're not, why not? Because it can affect the brain, it can affect their mood, it can affect their life.
As a sleep expert, when it comes to dreams, do you see them in any esoteric, deeper meaning of life? Because they're such a mystery type thing, right, for all of us. But you're somebody that's dedicated a good part of your life to sleep, and this is within that realm. So I'm just curious how you see those.
Dreaming, I think there's so many benefits to it. I say, if you can be more in touch with your dreams, there's so many benefits. For example, take the story of Thomas Edison. Okay. Everyone knows Thomas Edison. Did you know that when he was in his lab and he would take a nap, he used to hold these like steel balls. Okay. And he would hold them and he would take his nap. And then once he would start to fall asleep, he would drop the ball and then that would wake him up. Okay. But in that moment, kind of that between full consciousness and unconsciousness, and kind of like a dream-like state, he would come up with these creative ideas that's how he came up with many of these inventions too. So our creativity in that state, as long as we can like remember some aspect of it, can be hugely beneficial for us in our lives. And then again, sometimes it's not just the content of the dream, which can often be bizarre, but think, what is the emotional component of this dream? And if you can understand that, then I think that can make a profound improvement of how we deal with stress, exposures that we've had, past traumas, which can sometimes just keep coming back and in different forms. So how do we need to process it and move on. And dreams is a method by which we can accomplish that.
For somebody realizing through testing they're not getting that REM sleep, that deep sleep, given their importance, are there ways to hack that and get more of those? If somebody's realizing consistently through testing, I'm just not getting there.
So they need to know, what are the REM suppressants? Okay, what is preventing you from getting REM sleep? Number one, alcohol. Probably number one on the list. Stop drinking. Number two, medications can play a role. Things like beta blockers, which a lot of heart patients might be on, they can suppress. Sometimes switching to a different kind of beta blocker that doesn't cross that blood-brain barrier, so it can't enter the brain, it's less likely to affect the sleep. So if you have a cardiologist and you're on a beta blocker, I'd say talk to your cardiologist about switching to one of those. Um, Other medications, notorious, is psychiatric medications, SSRIs. Um, so things like Zoloft, Prozac, very potent REM suppressors. Now you can imagine the concern I have here. These patients presenting with anxiety or depression are taking a medication that suppresses REM, which results in anxiety and depression. Right? It's a problem. But the medication is trying to increase serotonin, which is that feel-good neurotransmitter, so they feel better. But if you look at if you're going deep into that individual's physiology, by suppressing REM, we're kind of throwing fuel at the fire. So they are antidepressants that don't affect REM. And so switching to something like that can make a big difference. But I think that's an area of psychiatry that hopefully in the next years to decade, we become more and more aware that these individuals need more REM, and so we need a medication that doesn't reduce their REM. Would be hugely beneficial. And then also note this. When do you go into REM? It's the second half of the night. So are you waking up multiple times in the second half of the night? If so, you're missing that opportunity for good REM sleep. So take, for example, sleep apnea. For most individuals, sleep apnea is worse in REM sleep. Why? The reason is when someone is in REM sleep and they're dreaming, their body becomes paralyzed. That's critical because otherwise, if I'm dreaming that I'm fighting someone and I start throwing punches in bed, that's a problem, right? So my body needs to be paralyzed. If my body's paralyzed, so is my tongue. So are these muscles here in my neck. So if those are all paralyzed while I'm in REM sleep, my airway is more floppy. And therefore, I'm more likely to have an obstructive apnea where my airway blocks my airway, it gets closed off, and I can't breathe. That's an obstructive apnea. So some individuals only have sleep apnea when they are in REM sleep, in which case they'll know the first half of the night I sleep great, and then the second half of the night, it's like I'm waking up and I feel like I'm choking or something like that, in which case they, of course, have to treat the sleep apnea. But that very common that will affect their REM, and then ultimately 50% of those individuals will also present with depression-like symptoms. Not surprising there.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
This is an alarming study. If you take a group of individuals and you limit them to less than 6 hours of sleep, and you were to check their